Hi, everyone, and happy holidays. We've done this before, but what I want to do is review the top 12 things that come from Vista Apex Solutions that I couldn't do without. So we're going to start on the restorative end because, as you know, Vista Apex Solutions has a lot of different materials. So I'm going to start, like I said, with the restorative side. So when I'm doing a direct composite restoration, one of the things that I really like to use is our velvet etch. What makes velvet etch different? One, it's just 40% phosphoric acid, but it's purple. It's easy to place. It stays where I place it. It's easy to remove. You can take your little suction and go over it and pull most of it off, and then it rinses off really fast. So I really like velvet etch. It's just different. It's a velvety purple color, not blue. So when I'm doing a restoration, I don't ask my assistant to hand me the acid or the acid etchant. I just say, hand me the purple, and that's what I get. And then I rinse off that velvet etch. And if I'm worried about any type of sensitivity, we have Desensamax. Desensamax has everything in it that you'd want. It has fluoride, chlorhexidine, HEMA. It has everything in it to prevent sensitivity when you are placing a restoration on that patient that has a lot of sensitivity. And we also use Desensamax on those patients that come in and they have the root sensitivity. So our hygienists will place Desensamax on the roots and then do the hygiene procedure, and the patients are much more comfortable. I've talked about this before. When we place our direct composite restorations, seam-free. Seam-free is a composite wetting resin that does not affect the physical properties of your composite, but it saves me a ton of time. Why? Because when I place the composite, especially the sculptable composite, it's got that full body. Why do I want that? Because it has better strength properties. But in order to increase the filler, it makes it stiffer. And so with seam free, the composite I can shape, it doesn't stick to my instrument. So I can basically shape it to the final contours, but before I do my final cure. And so it saves me a ton of time, because before what I do is I'd kind of place my direct composite a little bit bigger than I really needed it to be. And then I would have to go back in there and trim it back, like with disc or burrs. Well, now I just basically take it to its final contour and then I cure it. Talking about our composite, when I place that sculptable composite, I like to use my Regen adhesive. Why? Because it's a bioactive adhesive. And so imagine I've got my dental tubules open, I've removed the smear layer with my velvet etch, and now I place a little Desensamax just to re-wet those dental tubules, allowing our adhesive to really penetrate into the tubules. So I use my bioactive adhesive, and then I use my bioactive flowable composite liner. And this composite liner has a bioglass in it. And we've talked about this during our many YouTube videos, that the bioglass helps to create a more alkaline environment. It helps to create more hydroxyapatite. So on my gingival floor margins, it makes that area less prone to have recurrent decay because it creates an alkaline environment, and the bacteria does not proliferate as well in the alkaline environment. And then if it does produce any acids to break down that restoration tooth margin, it's going to help attract more calcium and phosphate into that area and remineralize that area. So I really like to use bioactive materials. So we use a bioactive Regen adhesive, put that into the dental tubules, and then the floor of my composite restorations, I use a Regen flowable composite liner. And then when I place that sculptable composite, what do? Is I warm it up. So I have the desktop or benchtop version of my composite warmer. So when I pull my composite out, it just flows. And then we also have the phaser. So this is a composite warmer and a composite gun all in one. So we use a near infrared technology in our phaser to warm the composite. And what this allows us to do is, with that warm composite, we get better adaptation of the composite material to our tooth. We get better physical properties because we've warmed the composite before we placed it. So we get better composite properties, we get better adaptation. And then the last thing we need to do is we need to make sure that we cure it thoroughly. So I've got my pink wave curing light. Remember this, it doesn't have one wavelength. It doesn't have two wavelengths. It actually has 4 different wavelengths. And you can see how bright and powerful that is. And one of the things that I really like about the pink wave curing light is that you can slide on this little hood, and this is the tacking tip. We have one that will help you when you're trying to do transillumination, and we have another one that will help you get a nice tight contact because it's shaped like a ball. But with the tacking tip, a 2.5 millimeter diameter tacking tip, you place your restoration, and so that you don't cure all the composite if you're using a resin luting cement, just wipe off the excess, maybe on the buccolingual, take that small tacking tip, cure that little 2.5 millimeter area at the gingival margin, so now the restorations won't move if you're doing a crown or if you're doing veneers. So you tack them into place, and then you wipe off all the excess, and then you do your final cure. And when you come in to do your final cure, because we've got a lens here that's over 12 millimeters in diameter, you can place this, let's say, on a central, and you're going to cure the whole central, or place this over the occlusal of a crown. Let's say it's a molar crown. It's going to cover the entire restoration. So in that curing time, you're going to cure the whole area. Versus if you have a small lens, you might have to do overlapping cures. It's just going to take you more time. And this is one powerful light, again, with those 4 different wavelengths. So you're going to get a better cure, and you're going to have less sensitivity because you've cured your resin so well. On the restorative side, I forgot to mention one of my favorite things, and that is a hemostatic agent called QuickStat Free. QuickStat Free is actually a clear aluminum chloride hemostatic agent that works. I use this every day. And I get those cases where I have that area of deep decay, or I'm subgingival, or maybe I'm not subgingival, but the gums are just really swollen and inflamed. And we're trying to do our restorations or maybe do an intraoral scan. And I take this QuickStat Free and I go around the gums, and I'm not even scrubbing it. I just irrigate that area basically, rinse it off, and I've got a clear field of view. It's not just aluminum chloride. It has a magnesium in it and special surfactants. And it's the surfactants and the magnesium that make this more effective than any other clear hemostatic agent you use. Especially in our practice, we do a lot of anterior work. Now, one of the things when we're using a ferric-based hemostatic agent is the patients, when they look at that brand new veneer case or the composite we placed in their smile area, and we hand them a mirror and they smile, they go, wow, that's a really nice looking veneer that you did for me, or a nice looking composite tooth colored filling that you just put in for me, but why are my gums brown? And using the QuickStat Free, we no longer have to worry about that. So I wanted to add that in there because, I don't know, I think everybody should be using QuickStat Free, and I wanted to come back and point that out. So on the restorative side, these are some of my favorite products from Vis Apex Solutions. Let's go check on the endo side now. Okay, we're going to continue down on the endo side of what Vis Apex Solution has. And so, you know, we've talked about this during some of our past programs, that we have an advanced irrigation protocol, and that's using Chlor Extra, which is a 6% sodium hypochlorite. But the sodium hypochlorite has special surface modifiers or surfactants, which helps to dissolve the tissue faster and better. And then we've got the smear off, and the smear off 2-in-1 is basically your EDTA and your chlorhexidine all in one bottle. So we have a simplified irrigation protocol. Now, as we do that irrigation, we have the Voyager irrigation tips. And I really like these Voyager irrigation tips because they already have the stoppers. And I really like the Voyagers because they come in a 17 and a 27 millimeter tip. So the length, you can choose whichever is your favorite, most appropriate, either 17 or 27. And it's dual side port. And with the stopper on there, I know where I'm going down into the canal. And with the dual side port, there's less chance of having any kind of sodium hypochlorite accident. And then what Vis Apex Solutions now has are different color syringes. So you might have your red for your sodium hypochlorite, you could have your blue for chlorhexidine, and yellow for your EDTA if you'd like. So no longer do you have to write on the syringes what it is that's in that syringe, but you can just go off the colors. And so there's less chance of having any kind of confusion there. But again, we've talked about this. As you irrigate, you want to agitate the irrigant within the canal to really mix it up with all the bacteria and all the tissue and debris that's in there to really clean that out. So I really like to use my Endo Ultra. The Endo Ultra is like a 40,000 hertz instrument that really gets into the canals and shakes everything up. And the research has shown that you're going to get a better, cleaner canal when you use the ultrasonic activation. Well, and then one of the things, and I covered this recently, is that I go through all the files and I go through all the liquid irrigation, I activate it, but we still don't know how clean that canal is. And so what I've got my endocator. So with the indicator, we withdraw some of the sterile water and we test it in 10-second test in the indicator to see how low our score is. And again, a low score is going to indicate that I've got all the bacteria out because we're measuring cellular ATP. If the score is 25 or higher, then I might want to go back in there and just make sure I've got everything cleaned out. Maybe some more instrumentation, maybe some more irrigation, maybe some more activation until we get that score below 25. All right. So once I've got it cleaned out, we dry the canal out, and I'm going to use my bioactive endo sealer to seal up the canal with my gutta percha. Well, all these bioactive sealers that we use in our root canals, they're not cheap. So what I want to do is when I express it out of the syringe, I want to make sure that I don't have waste. And so one way that we can minimize the waste by over 80% is by using the MST visco tips. And basically what happens is these tips fit into the hub of our syringe. And instead of you extruding your sealer and filling up this empty space before it goes out the needle, this needle fills up that empty space so that as soon as you start to extrude your bioactive or bioceramic sealer, it's just coming out of that small lumen of a needle. So I really like these MST visco tips because you're going to save a ton of money. I also like these because they come in a polymer or a stainless steel tip. I like the stainless steel tips just because I can get into the canals and I can kind of feel the canal walls as I'm going down. So I like these MST visco tips. All right. So I get everything sealed up. Maybe we've used the indicator, or maybe we didn't have one, and the root canal tooth fails to heal. Well, remember, Vista Apex has their endo sealer solvent. So we take out that main gutta percha point, and now we have access to the sealer, and we use a sealer solvent and we work it down into the root canal, and it just starts to dissolve that sealer. So it allows us to clean that area out again. It's a proprietary mix, but it's very gentle to the canal walls, and so it's not going to weaken the canal walls as we remove the sealer. So worst case scenario, we have the endo sealer solvent to get back in there and help us remove the sealer. And I forgot to mention in the other room that when we go to do our restorative, I want to jump back to what I didn't mention before in our restorative. Is that this apex, we have our ZRC and we have our ZRP. And the ZRC and the ZRP, when we're cementing zirconia, the ZRC helps to remove the phosphate contamination, salivary contamination from the inside intaglio surface of our zirconia. And then the ZRP helps to prime the surface of either any of our restorations, our lithium disilicate, our zirconia, and it primes that and helps us create a good chemical bond to the prep. So after we've done our root canal, a lot of times we're going to put a crown over the top, and I want to make sure that it bonds really well to that tooth. And another product that I couldn't live without is Ribon. Ribon is the fiber, and that fiber can be used to fill up some of the canal space so that we have less polymerization, shrinkage, stress, either in our direct composite restorations or indirect restorations, or if we have to create any kind of splinting, orthosplinting, a periodontal splint, or maybe an aesthetic bridge, we can use the Ribon. So if you haven't used Ribon before, learn more about it. It's been around for decades. It's always been improving over all that time, but it's kind of an indispensable material. to use in your practice, especially if you have a minimally invasive aesthetic type of practice. So that's another one of my favorite things from Vista Apex Solutions. All right, let's go check out on the preventative side what Vista Apex Solutions has for you. All right, so on the preventative side, this is one of the things or the suite of things that I'm probably most excited about. Why? Because I believe that there's dentistry 1.0 and dentistry 2.0. Dentistry 1.0 was the way I was taught to do dentistry, right? We wait until there's disease. We wait until there's a cavity. We wait until there's periodontal disease. And then we get in there, we treat it. Insurance companies reinforce this because in order to be reimbursed by an insurance company, I have to show them disease, right? I have to show them that there's decay, a cavity there radiographically, and then I restore that with our regen materials, and then I can send that into the insurance company and be reimbursed. So basically what we've been taught in dentistry is how to identify disease and then how to treat disease. Dentistry 2.0 is going to be different though. And I think patients really want this type of dentistry. And that is, let's not wait until disease occurs, let's prevent disease. And so what we're doing in our practice is we're using some biofluorescence technology. And this is just one example, right? You put it up to the patient's mouth and you can actually see the biofluorescence indicate where there's biofilm, where there's tooth wear, and where there's tooth cracks. And so we can show patients what's going on in the mouth before anything bad happens. We can show them where the biofilm is because you know what? The biofilm is where it's concentrated is where we're most likely to develop gingivitis, periodontitis, perimucositis, periimplantitis, right? Because that bacteria is right at the gum line. And then where are we most likely to develop decay? That is where the biofilm, the bacteria, is sticking to the teeth interproximally or wherever it may be. Sometimes the white spot lesions that happen on the facial or buccal cervical areas of the tooth. But when we try to show patients what's going on in the mouth, it's very hard for them to see, even if they hold the mirror up, because all that plaque is usually white, right? So we can see it, but our patients who aren't dental professionals, they have a hard time really identifying what is it that I'm trying to remove. When we use this biofluorescence technology, it shows them that biofilm plaque as a red color, and we tell the patients anything that's red is bad, and we want to treat those areas. And how do we treat that? Well, if we have a lot of red at the gum line, then we start to use ParaProtect trays. Why ParaProtect trays? Because they're custom made to hold whatever gel we have in these trays right up against the patient's teeth. And when we use something like Perigel, there we go. So I got my Perigel. Perigel is 1.7% hydrogen peroxide. And the way these trays are made is so that there's like a gasket right at the cervical sulcus area. And that gel is going to be pushed down into the sulcus to get deep down into where the bacteria is. And so if we identify biofilm, and now our patients understand, okay, that's what's not good, and it's right at the gum line or below my gums, and what I need to do is I need to treat that. Well, it's really hard to treat that with floss. It's really hard to treat that with a toothbrush. But when I use these really comfortable, clear ParaProtect trays and it squeezes that hydrogen peroxide into the sulcus and gets rid of that biofilm, that's a good thing. And then we have patients that might have those white spot lesions, or we might be picking up maybe on your AI, we use Pearl, we might be able to pick up some small incipient interproximal decay, that's just starting to occur. And our AI picks that up. Well, what we now do is we use the ParaProtect trays with this Remin gel. And the Remin gel from Vista Apex Solutions has all the precursors of hydroxyapatite. So I just tell the patients, what happens is you get the biofilm. The biofilm is bacteria. The bacteria produces acid. The acid removes the minerals from the tooth because our teeth are minerals. It's like a diamond. They're very strong. But this acid just dissolves that tooth structure away. With the Remin gel, we've got all the precursors to basically repair that area of the tooth. You wear your trays just 10, 15 minutes a day, and it's going to hold that remineralization gel right around the teeth and help them repair themselves. We've had great success. We have patients that come in and they have a lot of sensitivity. So we have them wear the trays with the Remin gel, and that sensitivity within a week is gone. So this is all part of Dentistry 2.0. We're going to be able to identify areas where disease is most likely to occur. We are then going to be able to show our patients those areas. They're not going to just be white. They're going to biofluoresce red. And then we're going to be able to give them solutions like PerioProtect trays with PerioGel to help with the biofilm in the gum area, and Riemann gel with the PerioProtect trays to hold that gel up against the teeth where we might have white spot lesions or early incipient lesions, and we're going to be able to repair or prevent those areas from getting worse minimally invasively, just with trays and gels. And so I'm really excited about what 2026 is going to bring as we start to use these gels even more. So again, these are my 12 favorite things from Vista Apex. And I hope you've enjoyed these different YouTube videos during the year where we talked about all these individual materials. But these are the materials I enjoy, and I hope you do too. We are trying to create a community of like-minded colleagues trying to do the very best for their patients. And I think that move to Dentistry 2.0 is just an example of that. This Apex Solutions makes a bunch of great materials that I'm using every day. And so I hope that if you like this information, you hit the like button. And just to make sure you don't miss out on any of this information in 2026, please hit the subscribe button. We'd love that. Send us your comments, and I'm looking forward to finishing 2025 strong. I'm looking for an even more exciting 2026. Again, we appreciate your support. Thank you very much.